Hello guys, welcome in this channel totalphysiology.com Vijay K videos. So today's topic is hypothyroidism. What is hypothyroidism definition? Hypothyroidism is clinical condition due to reduced amount of T3 and 4 for prolonged period. When T3 and T4 levels are reduced for a prolonged period, it causes hypothyroidism. T3 and T4. So what is the normal level of T3? T3 level is free T3 level and free TH level. Free T3 level is 2.8 to 4.2 picogram per milliliter. TH is free TH thyroxine is 0.8 to 1.8 nanogram per deciliter and TSH is 0.4 to 4 milli international unit per liter. This is normal. When it is reduced, T3 and T4 are reduced in amount for prolonged period. This will cause hypothyroidism. Secretion of T3 and T4 in short, hypothalamus secretes thyrotropin releasing hormone. This comes to anterior pituitary where it will stimulate formation of TSH, thyroid stimulating hormone, and thyroid stimulating hormone will stimulate after combining with TSH receptor. TSH receptors are present on thyroid cells, thyroid follicular cells. This will cause formation of T3 and T4. T3 and T4 when amount is less, amount is reduced, then it will stimulate formation of TRS and also formation of TSH. When it is less, when it is more, T3, T4 is being secreted in large amount, then it will depress TRS release and release of TSH, negative effect. So this is the basic concept of hypothyroidism. Now coming to types. Types of hypothyroidism. This is number one, primary and secondary. In primary, defect is up to this level, up to thyroid level, primary cause, primary of first degree. And above this, it is secondary. Second degree or secondary causes. Tertiary causes are also tertiary when it is in the hypothalamus. But we will confine in primary and secondary. Primary or first degree, secondary is second degree hypothyroidism. In primary causes, number one, that is reduced amount of iodine, reduced level of iodine. This is most common worldwide. Globally, it is commonest cause of hypothyroidism. Then reduction in or destruction of thyroid gland cells. Reduction of thyroid gland cells. This may be due to Hashimoto's disease, autoimmune. This is autoimmune disease where anti-TG, that is thyroglobulin and anti thyroperoxidase. Antibodies are for. Antibodies are for. Number two, this is permanent type. Then postpartum causes here anti-TPO is for. Anti-TPO antibodies are for. This is transient. This is transient. Number three, readers disease. This is due to IgG food. That is causing stimulation of fibroblast, stimulation of fibroblast causing increased fibrosis of the gland, and this will cause pressure symptoms. Pressure symptoms on this will exert pressure on underlying substances, underlying structures. It will compress trachea, esophagus, and recurrent laryngeal nerve. Recurrent laryngeal nerve. Then iatrogenic causes. In iatrogenic causes, removal of thyroid gland. Removal of thyroid gland. Partial or complete, total thyroid gland. Then come to radiotherapy. In radiotherapy, it is cells are destroyed. Then some drugs causes reduced amount of cells, thyroid cells, or secretion of the thyroid gland. Now coming to secondary cause. In secondary, number one point is also there, infection. Infection of inflammation may cause destruction of this cells of thyroid gland. Now coming to secondary, pituitary adenoma or surgery of pituitary gland, surgery of pituitary gland. Number three, congenital, it may be congenital due to defect in TSH receptor in thyroid gland cell, follicular cells. These are the causes of hypothyroidism. Now, third degree, that is in hypothalamic, defect in hypothalamic. It is not common. And tertiary, it is due to defect in hypothalamic. These are the main causes of hyperthyroidism. Now coming to clinical feature. Clinical feature, thyroid hormone causes is responsible for basic metabolic rate. So basic metabolic rate decreases in Thyroid hormones are responsible for basic metabolic rate and influences sodium potassium pump ATPase pump. This sodium out how to potassium in thyroid. This is sodium potassium ATPase pump is affected due to deficiency of T3 and T4. Causing effect is number one, weight gain. Number one, weight gain. Slowly, slowly the patient will suffer from weight gain. He will gain weight. Number two, cold intolerance. Cold intolerance. He cannot tolerate cold due to decreased BMR, energy is not, heat is not being produced, cold intolerance. Then depression on brain, it causes depression, dementia, loss of memory, memory loss, loss of memory, cognitive features are reduced. Due to cold intolerance, weight gain, and depression, patient is lethargy and weakness. He will feel weakness. Skin becomes coarse skin, coarse skin, dry and and lusterless. This causes deposition of mucopolysaccharides beneath the skin, causing non-fitting edema. Non-fitting edema. That is myxedema. Myxedema is produced orbital swelling, puffiness of face. Then it causes deposition of mucopolysaccharides in tongue, causing macroglossia. Causing macroglossia. Macroglossia, and as it's become large, thick tongue, it protrudes from mouth. Protrude from mouth. Periorbital myxedema. On heart, effect on heart, it causes bradycardia and diastolic blood pressure, diastolic hypertension. Again, TSH is also a stimulant to prolactin. In hypothyroidism, TSH level is, and this will cause increased prolactin, and prolactin will affect fertility. It causes infertility. Number two, menstrual disorders. Menstrual disorders. This is main features of hypothyroidism. Patient will suffer from overweight become overweight, he cannot tolerate cold, and depression, dementia, loss of memory, cognitive functions are reduced, and therefore all these causes him lethargy, weakness, and coarse skin, dry, lustrous skin, hair, loss of hair, loss of hair occurs. Then non-fitting edema, mesoderma is produced, and peritibial, so periorbital swelling, puffiness of face, etc. occur. These are in adult. In during infancy, it causes another thing, that is fitness. So, talking about this hypothyroidism, how we will diagnose clinical features, then diagnosis. Diagnosis by estimation of T3, T4, and TSH. In primary hyperthyroidism, T3 and T4 are reduced, while TSH is increased. In secondary, T3, T4 are reduced and TSH is also reduced. In this case, in this way, we can differentiate primary from secondary. Now, anti-TPO antibody, then anti-TG antibodies are estimated. CT scan of thyroid and thyroid gland, pituitary gland are performed. MRI, MRI of thyroid gland, thyroid and pituitary gland. Diagnosis. Then in differential diagnosis main points are depression, anemia, nephrotic syndrome, etc. Depression, severe degree of anemia. In case of anemia also, there is weight gain, lethargy, etc. What are the complications of hypothyroidism? Complications of hypothyroidism. First, mesodermal coma, about which I will talk in next slide. Mesodermal coma, very serious condition, medical emergency. Then heart failure, pericardial effusion, and cognitive defect. These are the complications, differential diagnosis and complication of hypothyroidism. Treatment, this is not in our domain, but thyroxine tablets are available. Thyroxine tablets are available, that is given in case of hypothyroidism. This is about hypothyroidism. I think I covered what is definition, types of hypothyroidism, clinical features, diagnosis, differential diagnosis, and complications of hypothyroidism. I think this will help you in your examination and day-to-day practice. Thank you very much. Please like, subscribe my channel and thank you very much for watching. Thank you.